Hi, my name is Stephanie Curran, and I decided to do my community nursing project on behavioral health nursing. What do behavioral health nurses do? These nurses in the community, they work with individuals, families, or groups to assess their mental needs. They also develop a nursing diagnosis, a plan of care, they implement the nursing process, and then evaluate the effectiveness of it. Behavioral health nurses also administer medication. They establish therapeutic relationships between them and their patients. And then they also educate the patients on different community resources and different medications that they take. Some patients that these mental health nurses see are individuals who have been diagnosed with anxiety disorders. They have panic attacks. They have phobias. Some people have debilitating phobias that these mental health nurses can help with. Other things are mood disorders such as bipolar disorder, depression, substance abuse, and any Alzheimer's or dementia patients are also seen by mental health nurses. Education needed to be a mental health nurse. You can get your associate, your bachelor's, your master's, you can get LPN or an RN. But to become certified in psychiatric nursing, according to the American Nurses Credentialing Center, the requirements are 2 years of practice as a full-time registered nurse, 2,000 hours of clinical practice in the psychiatric mental health nursing field, and 30 hours of continuing education in psychiatric mental health nursing, all in 3 years. Some other disciplines that the mental health nurses work with are advanced nurse practitioners. They work with psychologists, psychiatrists, and they can also work with social workers. Some skills and abilities to have as a mental health nurse or behavioral health nurse is interpersonal skills. This can help you maintain calmness with you and your patient. Communication is important to have in order to have great communication between you and your patient, or you and the physician that are caring for that patient. Behavioral skills, it allows you to appropriately respond in any sort of situation. Cognitive, this is important because you can use past experiences in order to help make current decisions with your patient. If you have seen something similar, you can help to form better ideas and ways to resolve issues. Environmental skills would allow you to recognize danger within your environment. Physical skills are important, whether you have to perform CPR, whether you're going out into a patient's home, climbing stairs, any sort of physical demanding anything physically demanding allows you to better prepare and care for your patient. It's also important to have sensory skills. You're going to use 4 of your senses while caring for your patient: sight, hearing, touch, and smell. A couple of nursing interventions that can be used throughout mental health or behavioral health is during counseling. You can do assessment interviews or crisis intervention. Promotion of self-care activities, such as teaching them how to use public transportation, self-grooming. Psychobiological interventions include administering medication, teaching them different relaxation techniques in order to help calm their anxiety. Health teaching can include medication use and coping skills. Medication use is important in order for the patient to stay compliant and make sure that they're taking their required medications how they should be. Case management can include offering information on the different community resources for these folks. It can allow for better communication between the patient and the family or their significant other. While researching Jacksonville Health statistics, I found that Florida is the 49th out of the 50th state. for mental health funding, and that Northeast Florida was the second most funded region within Florida. Suicide rates in 2012 were the highest in Jacksonville since 1998, and most people within Jacksonville are dying of suicide over homicide. Adolescents, sexual minorities, those who are unable to speak clear and understand English properly, low-income residents, elderly, and the veterans are groups most likely to have some sort of mental health need or mental health issue that they need help with. Ways that we can teach to these communities, I think, is to provide group education classes. Something that will allow for these people to come in and for free and learn about different resources that can help them, or different relaxation and coping skills and mechanisms that they are able to take home with them. If we provide any printed material, I would want to make sure that they're in both English and in Spanish for those folks who are unable to properly understand English. And make it large and bold print for the elderly so that they are able to read and understand properly. After researching mental health or behavioral health nursing, I did not realize how poorly funded this area of nursing was. Florida to the 49,050th in Northeast Florida, where we are living, to be the second lowest funded area within Florida. I work in the emergency room, so I do often see psychiatric or mental health patients come through. And what I would want to take from this is to be able to provide them with more education once they are discharged from me. I want to be able to pass on different resources and different community centers that are appropriate for them to follow up with. I think something that should be implemented within Jacksonville, and I wasn't able to see if it already was, I don't believe it is to have a mobile mental health care unit. This allows us to go out into the community versus the community coming out to us. It opens up for more patients to be seen. It helps to educate these patients who are unable to leave their homes or unable to provide transportation to our Department of Health facilities. We are able to put much more education out there if we were able to be out there in the community. That was my presentation, and thank you for listening.